Pagka sinabing vertigo, it's a very common condition. When you say vertigo, common to sa mga matatanda. Again, my name, yung hindi nakakilala sa akin, my name is Dr.Jun Reyes. I'm a physical therapist. And ang topic natin for today is vertigo. So please follow us on Facebook and share this video. Okay, we have Claudine here, so she's gonna help me show some exercises, okay? Hello, Jesse. Hello, Nita. Polilio. Edward. Loven, how you doing? Okay. Alright, so I'll explain what is vertigo. Yung vertigo, yun yung mga nahihilo, room spinning. Room spinning can be from the central component or from the inner ear. Pagka nagkaroon ng crystals that's displaced in one of the canals, nagkakaroon siya ng vertigo. Kaya we have to be very careful. Kailangan careful tayo sa pag-diagnose, no? Yung central component, napakahirap i-gamutin yan. Pero most commonly, yung peripheral component, that's your inner ear. It could be may infection tayo sa ear. Pwedeng may marbles kasi tayo sa inner ear natin sa semicircular canals. Sa each ear, we have 3 canals. Sa right ear and the left ear. So all in all, 6 canals yan. So pagka nagkaroon ng displaced crystals, nagkakaroon ng confusion ng signals. Okay? So pagka nagkaroon ng confusion, salamat Pam, nagkakaroon ng confusion of signals, no? Pagka nagkaroon ng confusion of signals, diyan nagkakaroon ng vertigo. Madaming pasyente na akala nila na stroke sila pagka may vertigo. Na nadadala sila sa emergency room. Akala nila na stroke sila. So most probably, it's the crystals that displace in one of the canals. Okay? Hi, Eleanor. Okay. So, bilang physical therapist and a vestibular specialist, na-encounter ko na halos lahat about vestibular condition. Ang pinaka mahirap gamutin is the central component. Sasabihin ko sa inyo ngayon kung ano yung mga condition na magkakos ng dizziness, okay? Ang dizziness na magkakos ng mga condition na magkakos ng dizziness is number 1, it could be hypoglycemia kung kung may diabetes kayo. If you have low blood pressure or high blood pressure, you can have dizziness from low blood pressure and high blood pressure. Okay? If you had a stroke, you can have dizziness. If you have an inner ear infection, you can have vertigo or dizziness. Pagka nagkaroon ng trauma, na nadapa ka, tumama yung ulo mo, magkakaroon ka ng dizziness kasi yung crystals mo, na-displace siya. Ang pinaka-importante dito, you need to see a medical doctor para malaman kung ano yung nagkakos ng dizziness kasi nakakatakot siya kung blood pressure. Ang Meniere's condition is one of the worst diagnoses kasi nagkakaroon ng hearing loss. Okay? If you have any questions about dizziness, is the right time to message me. Another form of dizziness is from multiple sclerosis. Pagka nagkaroon ng MS, magkakaroon siya ng dizziness. Okay? So, and cervical component, pagka may arthritis sa neck. So, I'm gonna do some exercise para sa mga pasyenteng nahihilo dyan. Okay? Because yung pasyente ko kailangan na umuwi. Okay, so I'm gonna show you and then we'll talk more about the difference between dizziness, okay? I'm gonna introduce Claudine. Hi, good morning, Jennifer. Good morning, Eleanor. Okay, I'm gonna show you some exercises. And this is Claudine. Okay, so maybe move closer so they can see you. So Claudine, for example, she has dizziness. So most probably it's a peripheral condition. May dizziness siya. It's the left ear is affected. Ang nangyayari sa kanya when she, pag tumitingin siya ng quick head turns, she get dizzy. This one. Bakit nagdi-dizzy ang pasyente? Because there's confusion of signals. If this one is weaker, if this ear is weaker, and this one is stronger, yung signals niya na nagpupunta sa brain is confusing. So the brain is reading it as a quick movements. So nagkakaroon siya ng dizziness. Okay, now, ano yung mga exercise na kailangan gawin ng mga pasyente? This exercise is for patients with peripheral vestibular dysfunction. So, madali lang yung exercise niya, okay? Number 1 is start with neutral, proper posture. And then you can do head turns side to side, back and forth. Just like that. 10 times. And then another movement is you do it up and down. 10 times, up and down, 10 times. Make sure na malapit kayo sa wall, okay? Kasi pag bumagsak siya, they would fall. So, mahirap na eh. Make sure it's safety first. Okay, up and down, 10 times, okay? Another exercise, I'm gonna show them first. Okay, another exercise is you can use a business card. Okay, a business card. How you doing, Janet? Eleanor, okay, if you have any questions. Paring Jerry, how are you? Okay, another exercise is using a simple card. Okay, this one, you're just staring at the target and then you're gonna do head turn side to side. Ang purpose namin as a physical therapist is to make you dizzy. Okay? Because what we're doing is we're habituating the brain. The more we trigger the dizziness, it gets better. Kailangan you have to be committed doing this kasi this will make you dizzy, okay? Number 1 is use the business card, look at the target, and then you can do slower head turns or you can do faster head turns. It depends on your tolerance, okay? Another movement would be up and down. Up and down would be just like this. Up and down. Okay. This is a very good exercise for patients with dizziness. All right, I'm gonna show Claudine. Claudine, you can do. All right, so basic exercise would be head turn side to side and keep looking at the target. Okay. Importante yan. Please share our videos. Walang libre sa Pilipinas, so keep sharing us. Follow us on Facebook. Okay, that's good. We can do that for 30 seconds. Now we're gonna do up and down, Claudine. Up and down. Keep looking at the target. Movements like up and down. Yeah. Keep looking at the target. Good. Nice. Okay, so you can do that for 30 seconds. All right. Another one is I'm gonna show you how to do the visual exercise or eye exercises. Okay? The eye exercises, watch me. This is a basic exercise. Alright? Walang libre sa Pilipinas, so keep sharing this video, okay? Alright, so eye movements, follow the target. So, nakikita nyo just the eyes. So, rotation just like that. So, Claudine, you're watching me, right? Mm-hmm. Yeah. And then you go the opposite side with the target. And you can go faster. Yeah. Alright, so let's do that. See, so keep the target. Good. Good. So you can do that for 30 seconds and then you can do opposite. Alright, good. So madami na akong exercise na pinapakita sa inyo. Unfortunately, there's not a lot of vestibular specialists in the Philippines. So take advantage, share these videos, follow us on Facebook. I'm going to show you other techniques. Importante to sa mga therapists din dyan, lalo na yung mga matatanda. Usually, ang benign paroxysmal positional vertigo is very common. 50% after the age of 65 years old. Common siya, nagkakaroon ng vertigo. Ang nakakatakot dito, pwede silang matumba pagka nahilo sila. Okay? But you have to be very careful. Hindi lahat ng vertigo is secondary to the crystals, displaced crystals. Pwede siyang dahil meron siyang tumor sa utak. Pwede siya dahil merong inner ear infection. Pwede rin siya dahil inner ear bacteria. There's so many things. So, kailangan you have to seek medical, talk to your medical doctors and appropriate tests. I'm saving you a lot of money. Sometimes, yung mga pasyente ko, they have to go through MRI, brain MRI, ECG, and those kind of things. I'm saving you a lot of money. Kung ano lang siya, kung benign paroxysmal positional vertigo, I can cure that, or we can cure that. If you have any questions, message me, okay? Another exercise, another reason bakit tayo nagkakaroon ng dizziness or vertigo is coming from the tightness of the neck around here. Ano yung ginagawa ko if they have tightness of the neck? Alright, so we can do some stretching. So, you can do some doorway stretch. Alright, so we can stretch that chest area, the pectoralis muscles. Stretch it. Okay? And you hold it for 5 seconds, and you do it for 10 repetitions. Okay, you do that. Just like that. Okay. Patient with dizziness secondary to cervical spine, we're gonna have to stretch the neck area. So, so how do we stretch this? Is you turn your head this way and you look down. You put your left hand behind your back, and then actually go this way. And put your hand here, and then just stretch that. Okay? Stretch it like that. Hold it for 5 seconds. So, sa mga pasyente ko nagtatanong dyan about the neck, this is gonna be a big help, especially yung may cervical spine spondylosis. So, stretch the neck. You're stretching your levator scapulae right here. Okay, this muscle here. Vestibular receptors are also part of the neck area. So madaming dahilan kung bakit nahihilo. So this is just part of yung mga dizziness, yung madaming reason kung bakit nahihilo. Okay? Alright, back. And then you do the opposite side. And you go this way. You hold it and you stretch. Put your hand to the side of the head and then stretch it. And you hold it for 5 seconds and you do it for 10 repetitions. Alright, good. Another one. Thank you, Claudine. She's the best. Alright, so we're gonna stretch the upper traps. You're gonna put your hand here and then stretch it like that. And you're stretching the upper traps. Maybe you can put your hand behind your back. Hold it for 5 seconds and you do it for 10 repetitions. Okay? Now back. Okay, stretch again. and you do it for 10 repetitions. Okay. And please have a seat. Okay. All right, so I'm gonna show you some exercise about another. This is one of the difficult exercise for patients with dizziness. I'm gonna habituate the patients. You're gonna the patient's gonna lean forward and then hold it for 5 seconds, and he's gonna lift his head up. Okay, I'm gonna show you how to do this. You can do this at home too. This is the last exercise that you can do at home. All right, last one, lean. So what you're going to do is you're gonna put your hands across the chest. You're gonna put your head down and you hold it for 5 seconds. Okay? 1, 2, 3, 4, 5, and then up. That's what you can do. All right, yeah. And then down. You hold it again for 5 seconds, and then up. Okay, let's do it again. All right. You hold it for 5 seconds, and then up, and wait till the dizziness is over, and then go this way, and then up. And you can do that with 10 repetitions. Right? Okay. Very good. Nadine, thank you for helping me tonight. And then I'll see you again. Thank you so much. Yeah. So she's gonna go. She needs to go home. Thank you again.
Bye-bye.
All right, take care. All right, so if you have questions, you can ask me now. Okay. Okay. So, hi, Jane. How you doing? Ileosoas. Okay. Next time, I'm gonna talk about low back pain and ileosoas. If kung meron kayo dyan mga patients with neck pain, you can message me because part of the vestibular dysfunction is your neck too. Remember guys, I'm a physical therapist. If you have any other conditions going on, you have to see your medical doctor. Okay? Those are the basic. Mag-rewind lang kayo kung ano yung mga exercises. Pagka lumalayan, make sure you see a medical doctor. I'm gonna talk about the central component. Kasi yung mga exercise na yan, pang peripheral vestibular dysfunction lang yan. Yung mga central component, ibig sabihin yan, yung may mga stroke. Yung mga na-stroke na, or may mga multiple sclerosis, or patients with tumor or cerebellar condition, okay? So, yung central component, it takes a long time to get better. We have to see, good morning, Rian. We have to get an MRI kung gaano na kalala yung central component or central nervous system. Kailangan meron ding medication na kailangan inumin kung meron kayong other conditions like high blood pressure, patients with multiple sclerosis. Doc, ako po may vertigo pero madalang pagod ako saka sumusumpong. Alright, so yung question na yan, kung may vertigo, madaming pasyente na nagko-complain ng vertigo, kailangan ma-rule out kasi yung inner ear mo is responsible for your equilibrium. Pwede kang, kung bata ka, most probably meron kang a virus or inner ear infection, especially kung may upper respiratory infection ka or stomach virus. So common siya. Okay? Maybe next time I'm gonna show you the Epley's maneuver. Epley's maneuver. Okay, Charles, I'll show you the treatment for benign paroxysmal positional vertigo. Ito, libreng-libre to. Guys, ito ang tinatawag na Epley's maneuver. Sundan nyo lang to. We can cure that BPPV, okay? So, importante to. Just watch me. Charles, can you hold the phone? Okay. So, just right here. This is the table. Alright. So, let's just say I'm positive for the right ear. A right ear BPPV. When you say BPPV, is your benign paroxysmal positional vertigo. Okay, it means your crystals are displaced in one of the canals. Usually it's a posterior canal. Okay, very important. Watch me how I do my Epley's maneuver. Okay, if it's the right ear is affected, watch me. So the right ear is affected. I'm gonna turn my head to the right. Lalagay ko yung ulo ko to the right, looking all the way to the right shoulder. And then I'm gonna lie down as fast as I can, okay? Maintaining my right side. Hold it for 30 seconds to a minute. Ang idea dito is pinoposisyon natin yung crystals where it belongs, okay? You hold it for 30 seconds. After 30 seconds, you go to your left. All right, let's go to the left. Maybe we'll show Charles Lee, maybe here. So makikita yung ano. Yeah, just like that. Okay, so from right, going to the left. You hold it for 30 seconds. Okay, 30 seconds to a minute. And then you go, after 30 seconds a minute, you're gonna lay on your left side, maintaining my head. It's showing, Charles. Yeah. No. Go back. Yeah. Okay. Looking down, you hold it for 30 seconds to a minute. Okay. After doing that, pagkatapos gawin yan, ilagay nyo lang yung knees nyo sa side, and then slowly get up. Para without moving my head. Okay? And then move your head to neutral. And that's the Epley's maneuver. Thank you, Charles. So, okay, so that's the Epley's maneuver. Pagka ginawa niyo yung test na yan, yung maneuver na yan, it's maybe it's around 5,000 pesos. Napakamahal yung maneuver na yan. 5,000 pesos to do the maneuver. Okay, to see, to do all those things. I'm just approximate. It could be less. I might be wrong. Okay. So if you have a vertigo, crystals lang yan, we can reposition it. Okay, so if you have any more questions, I need to go. Madali lang mag-cure ng BPPV. If you can, please like my page. Follow us on Facebook. We're helping a lot of people. We're helping a lot of Filipinos. Madaming nagme-message sa akin. Thank you, Doc, for helping us. Nagpa-private message. They appreciate us. Someone called me today crying, and she said, thank you for bringing my life back. So that's yung naitutulong natin. Dito naman sa New York, it's been a busy day. I think I saw 41 patients today. So it's really a tiring day. Meron akong pasyente na may dizziness din, but it's a central component. So we have to count our blessings. Yung central component takes a long time to heal. Nagkaroon siya ng stroke, so nahihilo siya. So she's seeing me here to improve her condition. Okay? Alright guys, kung may topic pa kayo na gustong i-discuss ko next time, please share my videos, like us, follow us on Facebook. Alright, have a good day and enjoy. God bless you guys. Bye-bye. I just want to say thank you to Kathleen. Hi, Kathleen. Thank you, Tita Bagayawa, Maribeth, Lay. Hello, Villia, Sevilla, and Paulilio, Julie. Hi, Jesse, Pamela, Janet Gutierrez, Perez, Mr. Gerardo, Paring Balid, Benji, Gems. Alright guys, Brienne, take care and bye-bye.